someone to see things the way another person has gone through this type of situation that we're about to speak about. We hope that everyone that is listening today will be able to view the commentary and be able to advise us maybe an email if there's any additional questions that or concerns that they may have. But today we do have um, Miss Sylvia, who would like to discuss her story and testimony in regards to colorectal cancer. So before we get started with Ms. Sylvia speaking, Ms. Chrissy, is there anything else you would like to add to the beginning before we start?
No, not right now. Must be a delay. Can you hear me?
Yes.
Okay.
Yes, I can hear you.
Okay.
Yeah, I was just asking, is there anything else that you wanted to add before we start with Miss Sylvia's story?
No, not at the moment.
All right. All right. Miss Sylvia, you can go ahead and just tell us your story in regards to colorectal cancer. And once you tell your story, then of course we'll ask you some additional questions, okay?
Okay, my cancer was discovered back in 2007. Now, I mentioned to Christy that I found my own self by me going to the bathroom. And number two, when it passed through at the very end of the anus is where this was a little lump. And I knew that wasn't supposed to be there. So I called the doctor and made my own appointment. And when he seen me, he did a biopsy, of course, and he sent the biopsy to a telepath or whatever people to have it examined. And he came back and told me that it was cancerous.
Oh, gosh.
So now I have to go back first before I finish that to say that for a long time, I thought about if I ever was told that I had cancer, that how I would feel about it. And I decided at that particular time that I was good. I'm sorry.
No problem. Take your time.
That I was good with the word.
Yes, take your time.
That I was good with the C word. And by the time he told me that I had cancer, so I was looking at him and he was looking at me. I don't know whether he thought or were waiting for me to break down or what. And I told him, okay, so what we going to do? So he recommended a doctor, Dr. G. He has a long letter word, long last name that's like 15 letters long that no one can pronounce just to call him Dr. G.
Right.
Oh, okay.
You know, he recommended him down at St. Mary's Hospital. So that's where I had my surgery, and he removed the cancer. And I had chemo and radiation. And the chemo was a pill form. And the radiation, of course, I went back for like 11 weeks. So they got it all. And then I went back to Dr. G. You know how you start out a month, or rather probably every week, if I remember, every week. And then it goes to every month. Then it goes to every 3 months, you know, you're going to stand out to that 5 years. Then after the 5 years, he told me that I was cleared.
Wow.
And that, as you can see, was 17 years ago.
Wow.
When I found it. But when I was clear was in 2012.
Oh,
And,
my goodness. Okay.
The thing is, I think for me, I don't really think about it that much until I get in conversation like this with anybody, because I see it as gone, not sleeping, you know, waiting to come back. Because he told me I had a type of cancer that Farrah Fawcett, if you remember Farrah Fawcett Major, she had a cancer also that she was traveling all over the country to find a cure for. I remember that she did that.
Yes.
But he told me, yes, you do have that same type of cancer that she has. But you know what? At the time, I couldn't say that God was present. That God was present in my life.
Yes.
But I knew he was there.
Yes.
I knew that. I always knew that. Wherever I went through in my life, I knew he was there. But like now, I can say that and be proud of that to anyone.
Yes.
Because I tell people, you know, people don't realize that God is watching you. He sees everything you do, how you treat people and all that. So people should be more mindful of that. And my kids, they was young at the time, and this was in 2007. But I even had medical issue even before that. And 2000, I had my first cancer kidney transplant.
Oh, wow.
In 2000. And then 2007, when the cancer came along, the first kidney lasted like 14 years. And then I had to go to dialysis and wait for another kidney. And I got another kidney in 2017. So when you don't been through a lot,
Yes.
you don't have time for stuff from people. And you see how the world is today, that you try to live your life. You don't try to pretend to be nice to people. I am nice to people, and I don't have a problem with that because I know that God sees everything, what everybody does. And if a lot more people will understand that, maybe they will be better people for that reason. Because I guess a lot of people, maybe now they don't believe in God. I don't know what the situation is. I really don't. I mean, I guess that's all I want to say about that. Well, after the Lymphedema, what we're talking about, that came up in 2022.
What came up?
The Lymphedema came up.
Okay,
2000 and not 2022. 2022, yes, because I had a doctor do he did points on the inside of my legs because I had a different lymphedema before that. And after he did those points in my leg, and when it changed to lymphedema. And that's what they had told me I had now. And my lymphedema is a lot different from Christy. Christy had that flash shooting, but thank God I didn't have that because I listened to your story. And I felt for you because mine was just swelling. And I also have the machine that I put on my legs twice a day, in the morning and in the afternoon or evening, whichever I choose to.
Right.
It pushes the people up and and it does help with the swelling. I don't have the issue like you have with the ankle thing because if anything, my swelling is more controlled now than it did when I had my first kidney transplant and when I first experienced the swelling. Because I called them and asked them, okay, I'm starting to swell, so what can be done? And I read that there's sometimes the edema can come from surgery. There's a type of surgery that it can happen from that. And I think that's where I know that's where mine came from when I had my first kidney transplant.
Right.
Okay.
Where mine developed from, starting off, and then it's developed into edema after he stripped my veins to try to help, but really
It didn't.
it just changed. It just changed from one lymphedema to another, but it did help. What made this one better
Mm-hmm.
because we do have the machine, and it does help a lot. But the lady also, my therapist, told me also to massage my legs, like pushing the fluid up your legs, and even my stomach area. You know, I have to massage the stomach area for that reason also, because I swell all over. I know that by the end of the day, I can tell that at the end of the day. Then in the morning, a lot of the swelling goes down. But of course, I still get on my machine in the mornings because I wake up at 6. I get up. Well, I didn't say I get up, but I set my alarm at 6 because I do have to take medication for my thyroid at 6 because that's the first medication that I have to take in the morning with no food or anything.
Okay.
So, and that's when I get on my machine. It's early in the morning. As long as I don't have an appointment or anything, I'll get on the machine and be on the machine for an hour. They already have it set up for an hour.
Mm-hmm.
So 2 hours out of my day is spent on a machine, and I don't mind it because of my history with the swelling and stuff. Because the swelling was worse the first time than it is with the lymphedema for me.
Right.
It was worse because I was wearing compression hose up to the knees that it will push because of the compression hose they had at that time didn't work like the compression hose I wear now.
Mm-hmm.
Because even the swelling was still pushed out on the hose itself.
Okay.
But for that reason, it's a lot better than it was then. But I still got the issue, so I just deal with it from every day. I just go about my life and just do what I got to do.
Right.
Take care of myself medically. So nothing else I can do.
That's wonderful.
Yeah.
Thank you for sharing your story. I mean, that's, you're so bold to come out and actually, tell us your experience. I really appreciate that. I do have a question for you. You said that you had to take a pill for radiation. Did you said
a pill for the radiation? Well, but actually, I'm thinking the radiation because of the he told me I didn't need to continue with that. I took a pill for like 3 days.
Okay.
For the chemo, it was 3 days like for that. But I went to the place. I drove myself back and forth to the place for the radiation for like 11 weeks or something because the cancer was, because of what the location of the cancer, it like they had to put the machine under the table.
Mm-hmm.
Under the table, and I had to, move over top of where the machine is, so the radiation can tap the
Okay.
because of the machine, it also burns you. So there was a cream that I had to use. They didn't tell me that at first that would happen until I had started burning. I went to my primary doctor to show her how I was being burned by the machine, and she recommended a cream.
Wow.
The cream for that.
Wow.
I mean, they should have gave you the cream really anyway, because they know the radiation is going to burn you no matter where the radiation is pointing. And, by being in a particular sensitive area, you should have got the cream from the beginning.
Yeah.
Really.
So just for clarification, the colorectal cancer is a disease in which cells in the colon and rectum grow out of control. And it causes discomfort in the abdomen, in your stomach, and it's a change in your bowel movement, right? Am I correct on that?
See, the thing is, Chrissy, I didn't even look it up to see the issues or whatever it caused. It's just that I knew at that particular time that I had cancer, and the doctor recommended this doctor at St. Mary's Hospital, and he just did the surgery. I never read up on it. Only thing I can tell you is that I didn't have any pains in my stomach or anything because they couldn't really say I was at stage 1 even, really, because I wasn't the one that found it. I went to the doctor to have it. He was aware of cancerous or not.
Wow.
And that's when he told me it was cancerous and made the, the appointment and stuff for me to go to St. Mary's Hospital to have this surgery.
Mm-hmm.
And that was it. I mean, I had no side effects. I don't take any medication for that. All my medication comes from my kidney transplants. That's all my medication comes from is that.
Okay. Miss Debbie, did you have any questions for her? It's a delay. Debbie.
Yes. The question that I had while you were giving your story, first of all, I want to thank you for sharing your story with us. That is a testimony that will help someone who may be going through colorectal cancer at this moment in time as well. But you said that, because I want to know what stage you were, but you said that they couldn't even tell whether you were stage 1 or a different stage. So they couldn't give you that portion. Is that right?
But I think they gave it a stage 1 because, you
Okay.
have to give it a stage, I guess. So they gave it stage 1.
Okay. Now, do you have anybody in your family that you know of that may have had colorectal cancer that you are aware of?
No, Miss Debbie, I don't. No, I
Okay.
don't.
Okay.
I don't.
Because I
Because
know,
I'm the only
because I
one.
know that sometimes, like when people get first diagnosed with, I'm sorry, go right ahead. I'm sorry, I couldn't hear you. There was a lag over here.
That's okay. Because it's 8 of us. It's 8 siblings. There's 4 of each. And I'm the only one in that immediate family that had the kidney transplant and the that type of cancer. But like back when we had the COVID-19 when it started, my youngest
Yes.
brother now, he had pancreas cancer.
Mm.
So I told him, I said, you know what, that pancreas is just that little thing that's in your body is just waiting to be activated. Because if you look at where it is, it's tucked away in a little hole in your body. That's the thing. And that's the only surgery that he had was that. And he's like 55 years old. He's the youngest. And he had pancreas cancer. And, it makes you wonder, if you never had any type of surgery or never been in the hospital for anything, but yet you get something as serious as that, make you wonder, well, I guess maybe God gave it to me for a reason, had this happen for a reason. So I guess that's for him to figure it out. But, I just thought that was real strange for someone that never had any type of surgery to have that serious, kind of cancer.
Wow.
No one else in the family have what I have. If they've been through anything, I'm sure it's something different. But I'm the only one that had a kidney transplant, and I'm the only one that had this type of cancer, whereas he had the pancreas cancer. I have the colorectal cancer.
Okay. Now, once I know you said that you had the cancer start in 2007 and you weren't clear until 2012. Is that right?
In 2012, I was cleared. After you go back every week, then you go back every month, then you go back every 3 months. They stretch it out for
Yes.
5 years. So after you reach that 5-year mark, is when they say that you're in remission, kind of thing. I think for me, like I said, I look at it as being gone because I don't think about the cancer as much as I think about that I had 2 kidney transplants.
Wow.
But I just think that it is gone. I really do. Not just in remission. So,
Okay.
I mean, my little body been through a lot.
Yeah. Yeah.
It definitely, you have, as me and Chrissy first started this channel, I have said in my video as well that I call it your storm. We all have a storm that we must go through, because in order to have faith, God makes things to work out for us, but we still have to go through the situation, but he brings us out on the other end. So that's why I call it a storm.
Yes, yes.
And the other question I had regarding the cancer is that once they cleared you at that point in 2012, did they advise you that you needed to go back in every 6 months, every year to have a colonoscopy just to make sure everything is fine, or what did they tell you at that point?
You know what, at that point, they didn't tell me that, but I do go back every 5 years. And, you know, and even the 5 year mark, I never reached the 5 year mark. I always
Okay.
get 3 year. And then I ask the doctor, I tell them I want to, you know, make an appointment for a colon test, because I always thought 5 years was a long time considering, you know, I had cancer.
Mm-hmm.
So, and I always have an
I
issue
agree.
with something going on. I just thought I had an issue with something going on that would make me go back to them anyway every 3 years anyhow. So whether it was like maybe my bowels wasn't moving right, or maybe I felt something or whatever, I will always go back to them anyway for, you know, after 3 years, because I want to make sure, because my doctors are all specialists. Even though my primary doctor, he's a specialist, he's a body doctor. He knows the body. So, and
Right.
that's why I have switched to him, because really I can just see him and he still be able to take care of, you know, the issues, all the issues that I have with the cancer, the kidney, thyroid, and all of that.
Mm-hmm.
But I have a heart disease doctor, I have a diabetes doctor, you know, I have a cholesterol doctor, they're all specialists in that field, and that's who I want to see, because primary doctors to me are different than specialists. Of course they are, because they are specialists in their field. Primary doctors know a little bit about each thing about you, but that's not their specialty. Their specialty is family doctor. You know, when you go to it for a cold, you know, whatever. But all my doctors are specialists. And I let them know that I'm not going to wait every year to come and see you, because I rather make my appointment every 3 months, because I want to make sure that everything stays good. You know, if something happens, that they can catch it even before I feel it, tell you the truth. Because I may just, you know, think it's nothing, but I want to know if something is going on with me beforehand, because just too much stuff out here that's going on, too many viruses and diseases and stuff that's going on out here that a lot of people don't care about, and they out around people and they sick.
Right.
You know, you don't know what you may be doing to me. My immune system could be compromised at that time, and then I'll be around you or pass through an air that you don't cough or you don't sneeze, and then I'll pick up something from you from that. Right. That's the reason I always wear my mask. Even today, I still wear my mask for that reason, because people don't think about that. That's but I do. So I'm going to wear my mask continuously as long as I'm here. If God see fit to keep me here, I'm going to wear my mask.
Because you got to protect yourself.
Yeah.
Yes.
You said you had 2 kidney transplants. Did you have to wait? I mean, how long did you have to wait for that? I mean,
I was on a list. I had got on a list. The first list I was at, I had my first kidney transplant in 2000 at Henrico Doctors Hospital, 2000. And I was on their list. And you know what? I thank God for them, because when I had that first transplant, no problem at all. No problem at all. I was in the hospital 9 days. And when I needed to drink water, you know, the thing is, I never seen my doctor. He would always look at my chart and tell the nurse, tell her this or tell her that. I remember the one day when he looked at my chart and told her to tell me to drink water, okay? Because I had got out of the bed and put my foot on the floor and my legs just blew up.
Wow.
my legs just blew up. I mean, it was 3 times the size. And then he told her to tell her to drink water. And then I was drinking too much water. He told her, said, tell her to stop drinking the water, stop drinking the water. So I stopped drinking the water. But you know what? That was a good one. That was good in that hospital because I felt Dr. Mendez knew what he was doing.
Mm-hmm.
And I'm grateful for him.
Yeah.
And when I had the second kidney transplant, I had that one at VCU. And I think at that particular time, I was thinking that my insurance was going to take Dr. Mendez because Dr. Mendez doesn't go into any hospital.
Okay.
That's the thing about him. So I ended up with VCU. And I would say, I appreciate the kidney. God knows that. He knows that. But I went through, I just say, I felt like hell because I couldn't eat. I couldn't sleep for the whole 6 days I was there. Could not eat or sleep. Only thing I could do was drink this green stuff. I guess this green stuff was giving me all the minerals and vitamins that I needed, I guess, because I couldn't eat any food.
Wow.
Then the moment that I had a bowel movement, they released me. I guess I was nothing wrong with me, I guess. That's what they was looking at. Was nothing wrong with me, but I could not eat, could not sleep. And I never seen a doctor. Never seen a doctor at all. I mean, 2 nurses came in. And I remember asking me, do you remember me? I said, no, because I didn't. Because I guess because they pumped me up with so much medicine.
Mm-hmm.
Keeping in mind, this is my second kidney transplant.
Wow.
They pumped me up with so much medicine that I think that's why I was feeling the way I was feeling, because I couldn't sleep, couldn't eat anything. You know, it's like looking at the outside and you see it getting dark, then it getting daylight again, then it getting dark and daylight again, you know.
Yeah.
That was something else. I'm going to tell you, well, I don't think I'm not going to say that part, but I would say the next time, if God forbid, anything happened to me again like that I would go to the Ranko Doctor Hospital.
I was going to say that takes a toll on your mental status day in and day out.
Yes, it did. Yes, it did. They're just saying, I'm glad the windows was locked. I'm glad the window was locked.
Wow.
That's how I was feeling.
Oh, no.
That's how I was feeling.
But God brought you through. He brought you through. Thank the Lord.
Yes.
Thank the Lord Jesus.
Miss Sylvia, you have gone through so much. And I know that what you have stated to us today and your testimony is going to help someone who's going to be looking at this video, because you've gone through your colorectal cancer, you've had 2 kidney transplants, and during the kidney transplants, that's when you also started having lymphedema. So you have a lot that's going on, and you have a lot to be thankful for God too, because He's brought you through all those situations. Even though you have the lymphedema, He still bring you through the lymphedema. And I do know that this testimony is going to help someone who needs to hear this, who may be just being diagnosed with it or just going through the situation. I know this is going to help. And we greatly appreciate you for taking the time to share your story with us, to hear your side, because everybody's story is different. Just like you said, Miss Chrissy went through it because of the flesh-eating disease. You attracted it because of your kidney transplants. So everybody goes through things differently. So we hope your story and this channel will help someone, to help them get through and over their hump of what they're dealing with through their own situation.
Yes, I certainly hope so. I certainly hope so.
Thank you so much, Miss Sylvia.
Something, I mean, the thing is, for me, I am a person that takes care of what I need to take care of. When you bring a situation to me medically, I just believe in taking care of what I need to take care of, because I could have not went to the doctor when I felt that little pass through. I could have just ignored it, and it would have been a stage 4 probably by the time they found it. because for me, it was no
You're
excuse
right about that. You're absolutely correct about that.
because it was no reason for me not to go to the doctor because it's not normal, when you have a bowel movement or to pass through something like that.
Right.
And you not go to the doctor and have it checked out. So for anybody that says that they may not have symptoms, I feel for you that you don't have symptoms because I guess if I didn't have that and it was further up my body, who knows? Maybe I would have been bleeding or something like that, or something would have had to give me a sign that I had something going on with me. Because I just can't believe some of the stories you have heard from people that say they don't have any symptoms and that kind of stuff. But I'm just glad I had a symptom or
Right.
sign
Yeah.
for this.
Yes.
And
Thank
listen to
God.
your body. Listen to your body because no one should be hurting or in pain. Go to the doctor and find out why you're in pain, and don't necessarily listen to what they are saying. Go to get a second opinion if you need to. Get a second opinion.
Right. Well, Miss Sylvia, thank you so much. Time is running out on us, so
Okay.
I really do appreciate it. You like Miss Debbie said, this testimony is a deep, deep testimony, and it will reach someone that's out there. So we just thank you, and we thank God for all things, and thank God for bringing you through this situation and allowing you to be at the point that you are today. Even with the two kidney transplants, that's amazing because people
Yes.
be on that for a long time. So you've been through a lot. You've been
Yes.
through a lot, and you are definitely a walking miracle.
Yes.
Both of you. You are too. Both of you are. We
Yeah.
are.
We will just say like this, all of us, for the grace of God, because we couldn't have gone through this without him. And I truly believe that when something occurs to us, it's God's way of saying he wants us to work for him. There's something that he wants us to do. We don't know what it may be. It could be something later down the road, but I feel like it's something that he wants us to tell our story and to help